There will be some changes and improvements to the nursing admission process, which are going live on July 27th for all inpatient and ICU nurses. So what exactly is changing? 1. You will be given a nursing admission MPage, which will guide all admission nursing documentation. You will no longer receive a task to complete the nursing admission assessment. You will just access the Power Form directly from the new MPage. The NAA has been greatly condensed to include only required and relevant admission documentation, and nurses will be using the problem list component on Viewpoint to document past medical history instead of using the free text past medical history box in the NAA. So now I'm going to demo the workflow for you. So as I just mentioned, you're no longer going to receive a task for the NAA, so you can enter the patient's chart through your patient list or Care Compass. Once you're in the patient's chart, you're going to navigate to Viewpoint and you'll find a new MPage here called Nursing Admission or Admission Nursing. This is what is going to drive all of your admission documentation. However, you still need to complete documentation on the flow sheet, so you can choose to do that first, last, or in the middle. Any order is fine. So you can go back to the flow sheet, enter any of the required admission documentation here, and then head back to the MPage when you're ready to complete the rest. So next I'm going to demo the 3 components on the admission MPage, which you are going to be documenting directly on. So 1, you're going to be doing your allergy history straight from here, so you can confirm the patient's allergies right on this page. You can add allergies. If there were allergies listed here, you could modify if you needed to, or you can select no known allergies. Once this list is accurate, you can complete the reconciliation so that people know that this has been done. Next is home medications. You're going to complete the same meds history that you do today, and to do so, you click on this link in the right-hand corner of the home medications component, and this will launch a familiar window. So you can add any home medications here, add your compliance as you normally do, or select no home medications. Once you document on that, it will give you a green check mark here indicating that this has been completed. And then lastly, the problem list is going to be where you're documenting past medical history. This is replacing the free text box that is currently in the NAA. So nurses will be limited to only adding chronic problems. This component is shared amongst many specialties and is updated in all clinics and inpatient visits. So this list should be up to date if the patient has been seen at Children's before, and you can just confirm that things are correct, or you can add and remove as needed. So I'll show you how to add a problem. You type it in this box and select the most accurate one. The prescribers can always go in afterwards and fix things if needed. And you'll notice that it will be added as chronic. Nurses are not touching this visit problems. That is the prescriber's workflow. If you need to resolve the problem that's listed here, it's no longer an issue for that patient. You just simply hit resolve, and then it will drop down to the resolved problems here. If you see a problem here that you want to add back and as a chronic past medical history, you can just click chronic past medical history. And that is the extent of which you will be using this component for. When you're ready to complete the nursing admission assessment, you're going to launch it from the admission documentation component. Over in the right-hand side of this component, you'll notice a drop-down arrow where you can link directly to the Power Form. You will notice that this will say required action and no results found. That means that no nursing admission assessment has been started. So the nursing admission assessment has been significantly cut down. We did move some things from other tabs to various other areas of the NAA, so you can get used to that as you go through this a few times. I'm just going to document a few things just to show you how this pulls through. Okay, and generally you would click off all of the required documentation. to complete the NAA, but when you sign the form, you will notice that there is documentation that pulls into this component. So you can see things specific from the NAA. So if you need to come back to review some information that was documented on admission, you can do so at any time. In addition, if you look under the forms header here, you will notice that this nursing admission assessment form has been started. And if you need to modify it, you can actually do so directly from here. Once you sign a nursing admission assessment for that patient, you will receive a check mark next to admission documentation, which indicates that this work is completed. The only other component that is on the admission nursing M page is histories. This is a view-only component where you can view family history if the prescribers have documented it, and social history will pull in from the social history control, which is in the NAA. The last piece of documentation tied to admission is the nursing admission note. This is technically the first progress note and is done in the exact same format as your daily progress notes. So you will complete this on the inpatient nursing workflow page and in the exact same format as your daily progress notes. Then you will come over here and select admission nursing note instead of inpatient or ICU progress notes. This note is replacing the progress note for that shift, so you do not need to write two separate notes. So just to recap, to complete all of the necessary documentation for a patient admission, you need to complete your required flowsheet documentation, the nursing admission assessment power form, the allergy history, medication history, and past medical history components. And then by the end of your shift, you need to complete a nursing admission note. And then you are done. Now that you have viewed this demo, you can log into PowerChart Train for some hands-on practice. You can also sign up for a live Zoom demo of these changes with the opportunity to ask questions. These demos are available to sign up for in NetLearning by searching the name Inpatient Nursing Dynamic Documentation and Admission Demo under Learning Opportunities. There are various dates and times available. If you still have questions, please visit the CHAMPS page on WebTube for more education materials, reach out to your unit's Nursing Optimization SME, or send an email to the CHAMPS Clinical DL.